Hey guys, Tony Maritato here, licensed physical therapist, and in today's video, I want to talk about some of my favorite shoulder exercises to do at the kitchen table. I'm here with my boy Tucker. He practically blends in with the floor, but let's talk about three of the main exercises that I have my patients do after a physical therapy evaluation as part of their rotator cuff rehab program. So these exercises are usually done somewhere around the 4th to 6th week mark. It usually depends on whether they're allowed to get out of the sling or not and what specific surgery they've had. So don't try to do these exercises on your own, but talk to your physical therapist to see if these might be appropriate for you. So number one is simply shoulder flexion. So when we think of overhead shoulder flexion, there's a couple ways to do that. As the shoulder gets healthy, eventually you'll just reach up overhead the way you did before surgery. But another way to do that is to bring the body down. And so what I like to do in this scenario is I set my hand on the kitchen table. I can either slide my hand forward as I flex my trunk, or I could slide my chair back. Either one is totally fine. And what we're trying to do is we're applying a little downward pressure the entire time we're doing the exercise. So as I'm applying that downward pressure, maybe 3 to 5 pounds of pressure, the muscles underneath the arm are working, the inferior musculature of the rotator cuff. Typically, that's not involved in the surgery itself. The surgical repair is usually more of the superior musculature. But the idea is that as I'm going down into that position, full range of motion would be my earlobe is in line with my bicep. This is effectively the same as this, but it's completely different in the sense that I'm pressing down as my shoulder flexes as opposed to lifting up as my shoulder flexes. So exercise for my patients, number one home exercise, assisted shoulder flexion on the table. Number two is a version of external rotation. So you've probably done something similar. You've seen other videos where people are pulling a rubber band and rotating the arm away from the body. In this scenario, what I'm doing is, again, my hand is placed on the table, but now instead of sliding the hand forward, as I bring my torso down, effectively what's happening is the arm is coming into this external rotation position. So external rotation is twisting away, internal rotation is twisting inward. I come down into this position. I would hold it for 20 to 30 seconds. I should feel a little bit of a capsular stretch. I should feel a little bit of a stretch through the pectorals. It should not be a painful position. If it is painful, either you're doing it wrong or you need to be reassessed by the physical therapist before you try any of these. So flexion first, external rotation second, and then the other one is internal rotation. And one of my favorite ways to do internal rotation, you can see that there's a backrest behind me on the chair. I simply put the back of my knuckles between my body and the backrest of the chair. As I sit back into this position, I try to keep my shoulder in a neutral position, my elbows out to the side. It's kind of like a chicken wing position if you're familiar with that. And I might spend a little time in this situation. I could watch TV, I could work on my phone or do whatever I need to do. But basically, I can work my hand further across. I could work my hand a little bit higher. Another version of this, depending on how tall the backrest of your chair is I could simply bring that arm across over the top of the chair. This chair is a little bit too tall. If I had a shorter chair, I could do both arms. But in this case, what I can do is I can wrap both arms, hold onto the backrest, and simply work on some posture where I bring my thoracic up, I hold a position 5 to 10 seconds, and then I let it relax back into my lap. So those are three really simple home exercises. They're modified versions of stuff that you've probably done in the physical therapy clinic. Talk to your therapist, maybe show this video to them, see if this is something that would be appropriate for you, and I'll catch you on the next tutorial.